AMSN is proud to support the accomplishments of our members by providing them with resources that aid in career development and goal achievement through grants and scholarships.
Whether you're seeking funding for CMSRN certification and recertification, or support toward pursuing advanced degrees and entering the next phase of your career, AMSN is here to simplify your pathway to growth.
CMSRN certification and recertification grant applications are accepted year-round, and the application period for the Higher Education Scholarship and AMSN Student Scholarship closes June 30th.
To learn more and start the application process, please visit amsn.org/awards-grants/scholarships.
On this episode of Med-Surg Moments,
We've been running up and down the halls trying to make room for patients. We've also had a visit from our DHS.
Starting to feel real now. Before it was like, oh yeah, this fun little party we're throwing in like a year and a half. And now it's like, oh my God.
I'm on month 8, so I'm kind of about to pop. Our topic today is navigating patient mobility and immobility.
Tube feeds, chest tube, Foley, and then you hear someone say, they want to get up to the chair today.
Okay, now you're going to walk. I'm like, I'm going to walk after all these things happen.
Instead of just boop, boop, taking a step back, he just knee buckled straight back.
Oh my God.
I was like,
The goal for every patient, no matter how sick, is to get them moving. But obviously it's not always safe.
Not everybody's goal is to leave the hospital, so if we're going to say, this is one step closer to getting out of the hospital, maybe they're not going to want to.
Maybe they don't care.
They're like, just give me the medicine. Just give me this. I just had surgery. Are you crazy?
I've been a nurse a very long time, and if nothing else, that's what I want you to be okay with saying and doing.
This is Marcela.
Eric?
Trish.
Kellye.
Sydney.
And Haley. Welcome to Med-Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med-Surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is navigating patient mobility and immobility. But before we get started, let's begin with some personal updates. Trish, why don't you get us started?
All right, I will do that. It's been a fun time here. The weather has been kind of rainy, and I don't usually say that. It's usually sunny here. Well, we've had quite a bit of rain, but that's okay. The flowers and grass are really pretty. And at the hospital, it's been super busy. We haven't had any break, which as I'm over patient flow, we've been running up and down the halls trying to make room for patients. We've also had a visit from our DHSR, our state. We've passed it, of course, but it was a stressful time. Been spending more time with family. And I was wondering how you guys have been. Sydney, more wedding plans on the way for you?
Yeah, just still in the throes. We're getting close. It's at the 4-ish month mark now. So we're starting to look at designing invites. I need to get those ordered. My fiance is planning his bachelor party now, which is going to be later this summer. So yeah, just really getting down to the wire. My wedding dress is getting delivered on Friday, which is very exciting. So yeah, I can't wait. It's starting to feel real now. Before it was like, oh yeah, this fun little party we're throwing in like a year and a half. And now it's like, oh my God. I know this doesn't even feel like the summer is here yet, and it's going to be over before we know it, and it'll be October. That's really it for the personal stuff. Work has been kind of the same, just catching up after being away for a couple of days for my bachelorette. Nothing really to update there. Marcela, what's new with you?
Speaking of weddings, I have 4 brothers. I'm the oldest and I'm the only girl. So my 4 younger brothers, I usually refer to them as brothers 1 through 4 to people who don't know them. So brother number 1 is in the military. Brother number 2, he is already married. They had a court wedding at the end of last year. This weekend is their church wedding. And I'm so excited because this will be my first time ever invited to be a bridesmaid for my sister-in-law. And my 4-year-old is going to be a flower girl, and my teenager is going to be reading at the mass. So we're all kind of nervous My husband is going to be one of the grooms. I'm like, we are integral to this. And I don't know if we can be trusted. I still need to make like an adjustment on my dress and somebody still needs shoes. So I'm hoping I don't ruin their lovely day. And then they're doing something a little unconventional because she's actually having a baby in August. So the reception is going to be kind of a combined baby shower. It's more informal. So we're really excited for this weekend. Hopefully everything goes perfectly as planned. Other than that, summer's coming. We're getting a new fence built, which I'm really excited because right now we have no gates because we had to take down the old one that was falling apart. So I can't just throw all my kids in the yard because it's open to the street. And so I'm so excited. We should have a fence in 2 weeks. They'll just go out there, get all muddy. I don't care. I can see them. Excited for that for summer. Work-wise, it's been really heavy. But last time I went job hunting, I realized that what I have right now is the best pay I'm going to find around for a PRN float nurse. I have not gotten certified yet. So that's still my goal by the end of this year to get certified. I'm hoping then I have a little more leverage when I go to interviews. That's my hopes. But right now I'm happy where I am at. I'm just tired of working every weekend. And then summer's coming up and I'm not going to be available every weekend. So I'll be patient. I'm just going to go ahead and be patient and then we'll see what happens. Haley, what's new with you?
I just wanted to ask before I get started with my update on if the fence is to prep for the dog.
He might be potty trained by the end of this year, and then next year we'll talk. For my last year on this podcast, we might be talking dog. We'll see. I don't know. Don't pressure me.
You'd be a great dog mom.
You would.
Spring is the best time anyway, so might as well.
There you go, next spring.
But for me, work is booming like it always is. We are hiring a ton of clinical nurse specialists, which is the role that I'm in. We have a very small but mighty team for my hospital. We have somewhere in between 9 and 12, and we're hiring 4 or 5 more. So definitely a big increase. They are seeing the value, which is wonderful for me for job security. But they are also hiring at a very unfortunate time for onboarding because I am about to pop. Well, I'm on month 8, so I'm kind of about to pop. So I will probably not be participating in onboarding. So good luck to them.
Oh, it's so exciting though.
Yeah, so no, it's really nice and it'll hopefully help reduce the load that's on me right now as well with all the people onboarding. And pregnancy-wise, it is, like I say, no update is a good update. I passed my glucose tolerance test, woohoo, and my blood pressure looks okay, double woohoo. So I'm just sitting and waiting and trying to move around as much as I can, which is hard when you feel a little bit like a whale. Getting out of bed, getting off the chair, getting harder by the day, but I will make it through.
I was going to say, are you trying to make it all the way to your due date?
Ideally, if I could not, I'll take it. For my first, I worked the day of, I went into labor and I got dental work done the same day. So it was just a busy day. So we're going to figure it out. I went out at 37 weeks. So slightly on the early side for my first, and I can only get so lucky with this one, but we will see. I'm just crossing all my fingers and all my toes. Great segue for moving on to our topic, navigating patient mobility and immobility. Mobility is, of course, a big part of AMSN's core curriculum. We all know that early mobilization isn't always easy. We're balancing patient safety, pain, lines and tubes, staffing challenges, and patient motivation, all while trying to help our patients maintain as much function and independence as possible. But then, it also becomes more than just getting a patient out of bed. There's pressure injuries, muscle loss, and so much more impacting nearly every body system. And sometimes, the decline can happen faster than we expect. Today, we're sharing our own stories, struggles, experiences, and approaches to patient mobility and immobility. Who would like to get this conversation started?
With patients, any Med-Surg patient or any patient in the hospital, mobility is at the top of our thinking. We actually have been measuring episodes of mobility for a while and made it a cute little competition, and it's called Platinum Sneakers. which has helped us actually get our patients moving a little bit easier just because it's been a fun thing for us. And the unit with the highest mobility percentage actually gets the little statue of these big, bulky little platinum sneakers on a secretive kind of thing. And the CNSs, Haley, and the educators actually show up on that unit and present the platinum sneakers at change of shift in the morning, which is kind of cool, and give the, hey, you were 85% with your mobility percentage this month, which is an increase or the highest percentage. And it's really worked for us. And it's been a really fun thing. So that has really kind of helped us improve our mobility percentages. It's actually all units, but it's really helped our Med-Surg units. Just an idea for increasing mobility.
That's so fun. Everyone loves like a little prize, a little competition.
Yeah.
I always love when we do these episodes where we reference the core curriculum because I feel like it's not something everyone either has access to or their organization can afford to give them access to. And it's such a great resource for just knowing and understanding what AMSN's focuses are for our field. And it's all just great information. I feel so informed when we do these episodes.
I was briefly looking at the chapter that addresses it the most earlier. It's a little short chapter, but it actually was reminding me just about deconditioning and just about skin changes that can happen with immobility. It just reminds you of all the things that not getting your patients up and moving them around, the things that can happen when you don't get your patients up, and the circulatory changes and how weak you become, and the blood pressure changes and the heart rate changes and the different things that can happen when you don't get your patient up and move around. And it's been about 2.5 years ago, I had a ruptured appendix. And I remember being in bed for just that day and a half afterward. And I got an ileus, a little snippet of story. And then they actually had to call a rapid response because my heart rate went up and everything that can happen. They gathered the core curriculum. I know. But I was reading the little core curriculum and I'm like, oh yeah, those things can happen to you because they did happen to me. The next morning, after all these things happen, the nurses come in and PT and they're like, okay, now you're going to walk. I'm like, I'm going to walk after all these things happen? You got to be kidding me, right? And I was like, I get it.
My gosh, you're like the poster child for this episode.
That's what I was thinking.
Your story is the perfect snapshot of the domino effect of mobility to immobility. And I was like, I don't even know where to start, but really it's from admission to discharge, all the different phases. And then when you go home too. So you look incredible. I'm glad you made it through that whole spiral of things. But yeah, that kind of reminds me of, like I said, from admission to discharge. You are a perfectly mobile, active person. You go in for a procedure and then digestive system, your skin, and then your follow-up, your PT afterwards. You're like, I'm up ad lib. What's going to happen? No, all of a sudden you're not. I remember I came in and I got reported on a patient. It was a stroke unit. It was a stroke ICU. I had never been sent to this part of the unit before. I'd been on the stroke unit but this was more intense. The person had just been admitted overnight. They realized he had a stroke. And so now I'm part of the first initial conversations. Okay, your life might be different now, might not. So that's the first conversation of, is this permanent? Is this not permanent? And we don't know yet. But on Med-Surg, it's rough because you got to go through this assessment for each of your patients. Mm-hmm. And it's intimidating for sure, whether it's because you have a big load that morning or because you're a new nurse and you're scared to touch your patients. You walk in and you get a report and you hear tube feeds, chest tube, Foley, wounds, and then you hear someone say, they want to get up to the chair today. So first steps, can the patient talk? Ask them what they can do. Second step, don't believe them. You have to assess because they're like, yeah, I walk to the bathroom all the time. And then they get up and they're heavy, you're carrying them 2 assists, 3. I was like, okay, wait a minute. Figure out. So the assessment is super crucial. The charting, I know they keep trying to fix it to where it's practical. And overall it is. But when you're actually talking to the patient, you can't really go through the charting verbiage and steps. You can't always do all of them at once, the way the charting says it. So do a gradual thing when you're talking to your patient in the morning. Like first the conversation, then what can you do with your top half? What can you do with your bottom? Let's get to the edge. And sometimes I'll tell a patient, you know what? I'm going to be honest. I'll tell them, like, we don't have the staff to safely get you from here to where you want to go. So right now we can do an alternative. We can do a bedpan. I can get you a commode. And sometimes they're really adamant. No, I want to do this. And this is the part where we can take it personally and then be like, no, that's not happening. No. Let's start with what I say is, let's give you a chance. I will get them to the edge of the bed and say, let's see how you do. And if I'm fully supporting your weight, then we're going to do a bedpan. So I kind of just go little baby steps at a time. And then sometimes family's the one that's really like, I want to get them up to the chair. And they're totally right. The goal for every patient, no matter how sick, is to get them moving. But obviously it's not always safe. So those conversations of just telling them this is the process, talking to them, once again, communication first.
Yeah, I liked your point about that. Like sometimes you have to explain to them that it's not safe to get them up, like when it's just you. I think every nurse at this point has a how I hurt my back story. This is my mobility, how I hurt my back story. Don't do what I did. So my first unit that I worked on was a cardiac telemetry unit. So every person had daily weights in the morning. And the day shift nurse said, oh yeah, he was getting up to go to the bathroom totally fine. And he's good, just like standby assist, whatever. So I'm like, all right. So I like wheel in the scale. And he even like goes to the bathroom, totally fine, standby assist. And I'm like, all right, pop on the scale. He gets on, get his weight. And I'm like, all right, go ahead and step off. And I'm kidding you guys. I wish we did video. Instead of just boop, boop, taking a step back, he just knee buckled straight back.
Oh my God.
I was like, I said, we're not doing a trust fall. Like, what just happened? Yeah. And I just immediately am like catching him. And I'm like, shouting, I need help in here. Even when you think it's safe, it's just better to have a second person. Even when they've been going to the bathroom fine all day, if they're much larger than you and you haven't assessed apparently stepping up one step on a scale yet, might just be best to have that second hand there to be safe, because otherwise you'll be Nurse Sydney with a bad back at 29.
And we don't want anyone to have a bad back.
Yeah.
Especially so young.
It's no bueno.
The biggest issues in my practice area are people being concerned, not wanting to mobilize patients because they're too concerned that the patient's going to fall. We have so many patients that have orthostatic hypotension. I know they mention it very well in the core curriculum. I try to reinforce that one of the best strategies that we can do to help reduce the orthostatic hypotension is by getting them mobilized, but safely getting them mobilized.
Yeah.
Like, of course, one of the risks of orthostatic hypotension is syncope. So ideally, if we have two people, if staffing allows, one person, I don't know if you guys use gait belts. I know we use gait belts.
We do.
Yeah. One person on the gait belt, one person behind with a chair. Ideal, perfect situation, getting them moving. But not all mobility is walking. Some mobility is sitting at the side of the bed and marching. That's better than nothing, and it keeps their muscle tone up and it helps move that plasma volume around.
That actually counts as one of our episodes of mobility. And we actually started using the gait belts. It's been about 1.5 years ago. We're not big utilizers of gait belts, but we made this big education initiative and started using the gait belts, and it's been a game changer for us.
You mentioned education, and I think you mentioned your case when you were in the hospital. It's like, you want me to do what? And this is how I feel. And I think that's one of the hardest leaps too, is to tell the patient, I know you feel horrible and that's why you don't want to move, but believe it or not, moving is
The best thing.
path to feeling better. It sounds like I'm lying to you, but I swear to you. And even in my case, my only experience being hospitalized, except for some kidney stones I had, last year, which were terrible, is pregnancy. So after being a nurse, my admissions having a baby is how fast you feel like you're sore and you can't move. It's like a reminder to me, okay, these Q2 turns are freaking crucial. I know sometimes you're so busy. Let's say you have 4 patients that need to be turned. I know that it feels like something you can put all the way on the back burner. And sometimes you can't because it's like, okay, your heart rate's dropping. We're not going to worry about Q2 turns right now. But you got to keep it up there because you get so sore or you get constipated or you get pneumonia. All of these things, I try to tell people, this incentive spirometer, you see it every time you come to the hospital. You think it doesn't really matter. It's mobility in your lungs. It's part of mobility, the incentive spirometer, because if you don't do that, you get fluid accumulated at the bottom of your lungs. So I think education is super crucial before you get them moving because they don't believe you. They're like, just give me the medicine. Just give me this. I just had surgery. Are you crazy? So the first step is the education. Then it's the baby steps.
Yeah, absolutely.
And setting goals that tie into what matters to the patients. Not everybody's goal is to leave the hospital. So if we're going to say, hey, this is one step closer to getting out of the hospital, maybe they're not going to want to.
Maybe they don't care.
Exactly. With my first pregnancy, I had a C-section and they're like, we got to get moving. That is one of the things that are required for us to take your Foley out. And I'm like, okay, well then I'm running. I'm ready.
Yeah.
I don't care if I'm half bent over. I want this Foley out badly.
I was a post-cabbage nurse for 7 years, and you had to put them on the cabbage pathways. Back then, we had the pathways, right? And so you instructed them like step 1, day 2, day 3. Our goal is out on day 4, but educated them on every step of the pathway, why we were doing what we were doing. So I think about tying the education into all of that. So I think if we were just careful about educating the mobility the same way. So this is why we're doing it.
And then I would say next, obviously it's on your to-do list and then educating them and then the goals and then actually doing it. Like Sydney said, safety, having as many people there as you need for that situation. And the other crucial thing to have there is the right equipment. One of the most challenging things about my current facility is that it's not as nice as my last facility. So there's 2 patients to rooms. They don't have a full-sized recliner at the side of every bed. They don't have a lift for bariatric patients or even the mobile lifts. I don't see them on most units. So I can't offer that when I should be able to offer that. I can't offer to them what we need to do the daily getting up. It's not fun as the nurse to not be able to offer the thing you know is best practice. I'm sorry, you should get up to the chair, but we can't do it right now because of staff, because of the equipment, because of the space. These rooms with 2 patients, I worked 7 years at a facility where it was 1 person for each room. So when I came to this, it hit me hard. I just want to apologize to my patients every time I walk in. I'm like, I don't know how we do this. Can we upgrade one day? So in the hospital where I do have the equipment, it's great if you know how to use it.
Right.
Once you get comfortable with it, I think that's part of the intimidation. I don't have time to set up this machine. I don't have time to get you all the way to the toilet. I have to go past 5 other med passes. So time, equipment, help, all of that makes us nervous. And then if we just practice as much as we can every shift, I've seen that machine. Can someone help me just mess with it a little bit? Then it becomes less intimidating. And then the next time you use it again and again, and it actually makes your life way easier.
And I think what we as nurses need to be able to say is to be honest about stuff like that and not to be afraid to say, hey, I'm not sure about that gate belt, or I'm not sure. I heard on Med-Surg Moments that gate belts will help me with mobility, and gate belts are not that expensive. So can you get me some gate belts? Because I heard that they would help me with my work. It's okay to be honest about stuff like that. And that's what we want you to know. No matter where you work, equipment like that, it's not fancy equipment. So I think that's what we want you to be empowered to say and to speak up, and to be empowered to speak up about your needs. You don't have to be in a hurry about doing your work, and speak up about your needs. And it's okay to say, hey, I'm not sure about how to do that. Can you show me? And always take the time for patient safety. And that's okay. We are nurses. I've been a nurse a very long time. And if nothing else, that's what I want you to be okay with saying and doing. And mobility is a simple concept of nursing. And we are taking this straight out of the Med-Surg core curriculum, that some of the information that we're talking about today, whenever you're listening. And it's okay to fall back on those concepts and to say those things and to take your time and not to feel like you're in a rush about doing those things. So,
To go back to if you're uncomfortable or if you don't feel safe getting someone out of bed, mobility is not only nurses' responsibility. You have a lot of support teams that are also in charge of that, sometimes much better equipped to evaluate that than we are. OT, all those teams that are coming in and taking your patient for a walk or getting them out of bed. I mean, there's nothing wrong with necessarily saying, hey, I don't feel comfortable until PT has seen you.
they're the experts, actually. Yeah.
Right. And sometimes they're going to say, no, this person is not safe to get out of bed, or they're going to give you the recommendations for what assistive devices they need or how many people you need to get them out of bed. So it is totally okay to say, you know what, I don't feel comfortable getting you out of bed. PT will be here by lunch, and by then we'll have a plan.
Absolutely. They'll do the initial assessment and they'll say, hey, I'm going to recommend 2 people, equipment. Absolutely.
That's one of the best characteristics of a strong nurse, knowing what resources they have available and knowing what resources they can use, specifically our rehab services partners who really do such a great job helping us promote mobility and prevent immobility for our patients.
Absolutely.
This past weekend, very sad case. A woman with cancer. She went through a bunch of infections and now she finished all her courses of antibiotics, but they can't figure out why she's still altered. In the meantime, you think, oh, there's nothing we can do right now. Don't forget passive range of motion. Because this woman, in the meantime, while we can't figure out why she's unable to assess, she's becoming atrophied. I can already see just a couple weeks. Her elbows are stuck, her arms are bent, her hands are curled. We got to remember that there's something we can do in those situations too. I did passive range of motion with her, and believe it or not, she's been so non-responsive, and I started doing these stretches with her. She didn't become ANO times 4, but she opened her eyes and she looked at me. And then it's also kind of like a bonding thing with your patient who is stuck in this predicament that they're in. And you can't really assess what level of consciousness they have or don't have. So there's always an option for mobility, whether it's the Q2 turns, whether it's passive range of motion, even massages on their muscles. Sometimes they have specific devices for this, but if not, we use rolled up towels in their hands so that their fingers don't get super curled.
I'd love to go around and have each of you share what your biggest takeaways were from this conversation. Trish, what were your takeaways?
I think my takeaways were the nurse certainly has a responsibility in providing mobility, being a mobility partner and assisting with immobility. You guys also reminded me that we're a partner. And my takeaway was that we continue to provide great feedback in assessing the patient for how the patient is doing as far as following plan of care.
Sydney, how about you?
My takeaway is that everyone should get a copy of the core curriculum. If you can't, then you should listen to this episode again, because It's got awesome resources for everything we went over and way, way more on Med-Surg nursing and immobility tips and tricks and helping our patients' mobility.
Definitely big plug for the core curriculum because it is a great resource, particularly for immobility and a bunch of other things. Marcela, what stood out the most for you?
Thank you for that reminder of the core curriculum, you guys, because I'm going to be teasing getting Med-Surg certified until I'm done being on this podcast. I torture my chapter president because she's like, did you take it yet? Did you sign up yet? Did you? I'm like, I will, I promise.
I'm going to
Stop it.
growl.
It's a great review. It's really a great snapshot review. But my takeaway, I really like the point that you guys made of no matter your facility's resources or limited resources, whether it's a nursing home or a hospital or a clinic, mobility in some way, shape, or form is always an option. Okay, the beds don't tilt, but we've got these wedges. The beds don't do this, but we've got the gate belts. So there's always something you can do for mobility, even if you don't have the highest tech or the best facilities.
I think passive range of motion is definitely something that we don't talk about enough as a strategy for our patients regarding mobility. They are no joke, and they are a slippery slope to pressure injuries. And then, of course, further complications. The big theme of this episode is dominoes. Everything just ricochets onto something else.
Yes.
But my biggest takeaway for this episode was definitely about the safety aspect of mobility. So making sure that we're assessing our patients appropriately to make sure that we have the correct level of equipment in the room available for our patients, whether they need patient safety equipment like a walker or a gait belt, or whether it's not even safe to get them out of the bed in that moment. And making sure, of course, that we have additional partners, whether that's rehab services or it's a friend who is a CNA or another nurse to help us mobilize our patients. To our listeners, thank you for joining us, and we'll see you next time.
We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to Med-Surg Moments wherever you listen to podcasts.
To reach us, use hashtag MedSurg Moments on your social post.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We're all AMSN members, and if you love Med-Surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the Med-Surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Sydney,
Eric?
Trish.
Kellye.
Haley.
And Marcela. And always remember, Med-Surg Moments is a moment in our lives and a moment in our Med-Surg careers that makes a huge difference.